Mr. Cochrane.
Thank you, Speaker. My question to the Premier. In the face of rising COVID cases and a new variant, which we know very little about, yesterday the Premier and the Minister of Health both refused to acknowledge or announce whether or not they would extend vaccine certificates. And vaccine certificates are a very important tool, especially for small business and for restaurants. No one's been hit harder by COVID than small business and restaurants. No one's been hit harder by the uncertainty of what the rules are going to be and the changing rules day by day. So we don't understand why the reluctance to just say, and with the new information, we're going to extend the vaccine certificate program, regardless of what the Premier said a few weeks ago.
To reply, the Deputy Premier and Minister of Health.
Thank you very much, Speaker, and thank you to the member opposite for the question. We did introduce a plan to reopen Ontario a month or so ago, and we indicated definite timelines for the reopening, timelines where we would be able to relax certain features to allow for people to be able to return to more or less the life they used to live. However, it was very firm and very clear from the beginning that Dr. Moore indicated that if there is a change in circumstances, if there is a variant that is going to cause a significant rise in cases, then we will have to reassess the situation. That is the situation that we are in right now because we don't know enough yet about Omicron to be able to make those determinations. What we do know that we have to do is to continue on the path of vaccination. We have lowered the age guidelines for people to receive the third dose. We are now giving shots to children aged 5 to 11. We've now got 22.1% of that age category covered. That is what we need to continue to do, is make sure that everyone possible that can have the vaccination receives the vaccination and continue following the public health measures as we have since the beginning of this pandemic.
The supplementary question.
I'd like to thank the Minister of Health for that answer. It seems we have the inside answer and the outside answer, because when the Premier announced that the masks were, the vaccine certificates were coming off January 17th, we didn't hear any caveats. It was, that's happening, be happy. And that's what we heard.
Renfrew Nipissing Pembroke will withdraw. Member for Timiskaming Cochrane has the floor.
Thank you, Speaker. And the mixed messaging is part of the problem. So when people who are vaccine hesitant hear on the radio that you won't need a certificate after the 17th, the impetus to get vaccinated, it lessens. Exactly the opposite message of what you're trying to convey here, Minister.
Question.
Why don't you just say, in light of the new information, we're going to extend the certificates, give small business some certainty?
Minister of Health.
Thank you. Well, in fact, there has been no mixed messaging. The message has been clear from the beginning. With the plan that was released to reopen Ontario in stages, with guidelines and with timelines, it was always made clear by our government, by Dr. Moore, by everyone involved, based on the science, based on the clinical evidence, that obviously if there was a change in circumstances, if there was another variant that came in that was going to cause an increase in hospitalizations, that it was going to be extremely transmissible, virulent, and cause people to perhaps not be vaccine useful, that we would have to change courses. Right now, we are awaiting further information on all of those issues to be able to understand what guidance we can then offer the people of Ontario. But it's only reasonable to expect that we need to wait to obtain that information from South Africa and from scientists around the world, that we then make a determination based on that evidence when we have it.
Final supplementary.
Thank you, Speaker. I would say that having the Premier say he doesn't believe in a split society that's very much mixed messaging. But what happened to the precautionary principle where you say, okay, so things are changing and we've got a system that works, be prepared that it's going to be extended, as opposed to here's the hard date where we're thinking about getting rid of it. And this isn't months. This is weeks. It's the short-term decision-making that has hurt the restaurant sector and the service sector throughout this pandemic. Open the patios, close the patios. Why don't you give them the advance notice that they need, use the precautionary principle, and say today we're going to extend the vaccine certificate program?
I'll allow the Minister of Health to reply now.
Our government has always made every effort to give as much advance notice as possible to businesses as to whether they need to remain closed, when they can start reopening, and under what circumstances. But right now, we don't have the information that we need. We want to be fair to the people of Ontario. We want to be clear and transparent with the people of Ontario. We've said already that we do not have the information yet. No one in the world does. Ontario is no different. We are waiting to find out about the transmissibility, the virulence, and the effect of this variant vis-a-vis our vaccines. We need to have this information. That is being fair and reasonable, and I anticipate that the people of Ontario will understand that, knowing that no one in the world knows how this is going to turn out. But once we do know, we will be giving people sufficient information in order to understand what we need to be able to do. It's not trust us, as I heard from the other side. It's let's rely on the clinical evidence to be able to make those decisions. That's what we've always done, and that's what we will continue to do.